and stayed out. To those who want to dance again, cheer again, hug again, to play, to work, to visit, to breathe. Now is not the time to give up. We are stronger than this virus. When it's your for everyone who pulled together from a distance, for everyone who stayed in and stayed out, to those who want to dance again, cheer again, hug again, to play, to work, to visit, to breathe. Now is not the time to give up. We are stronger than this virus. When it's your turn, roll up your sleeve and stick it to COVID.
What I miss is being out there, coming through the gate and getting ready to play. I miss the noise that Rider fans bring. If I was talking to Rider fans, I would say, get your shot, be ready, because we're going to have a football season and we need you in the stadium.
If you ever had to look a child in the eye that's relying on you to protect them, would you say, yes, I will protect you? And that's essentially it. I will get the vaccine, I will protect you, because you can't protect yourself.
Good afternoon. From the Legislative Building here in Regina, we have Premier Scott Moe, and joining us virtually is Saskatchewan's Chief Medical Health Officer, Dr. Shahab, as well as the CEO of the Saskatchewan Health Authority, Scott Livingstone. Premier Moe and Dr. Shahab will have some remarks, followed by time for questions.
Well, thank you. Good afternoon, everyone. Thank you for joining us here today. Our vaccine rollout continues to lead the nation. Our team of healthcare workers in vaccine clinics across the province have now administered nearly 360,000 shots. That's over 30,000 doses per 100,000 person population, and Saskatchewan is the first province to meet that mark in the nation. The growing number of Saskatchewan people vaccinated may be starting to have an impact on our case numbers here. Last Thursday, Saskatchewan's 7-day average peaked at 284 cases. Since then, it has now dropped to 247 cases. That's down about 13%. While that's encouraging, case numbers and hospitalizations are still too high. So we are extending the current public health orders that were set to expire on April the 26th by 2 more weeks out to May the 10th. As always, they will be reviewed and renewed or revised at that point in time. And for now, we need everyone to continue doing your part. Follow all of the public health orders that are in place. When it's your turn, take your opportunity to receive a vaccination so we can stick it to COVID. Our vaccination program has reached some important milestones, yes. More than 75% of people over the age of 60 have now been vaccinated. More than 50% of those over the age of 40 have also now received their first dose, and here's why that is important. 84% of all hospitalizations and 96% of all COVID-related fatalities in our province have been people over the age of 40. So by getting this group of people vaccinated first, we will significantly reduce those serious outcomes. Our age-based system continues to work well, both in terms of getting people vaccinated as quickly as possible and by reducing serious outcomes as much as possible. That said, now that we have made significant progress among older age groups, we can look at adding some other groups of frontline workers to the priority groups that would then be eligible for vaccination in the days ahead. As you know, right now, everyone 40 and older in the far north and 48 and older in the rest of the province is eligible to receive their shot. Based on current allocation schedules, we expect to lower the province-wide eligibility age to 44 and older this Thursday, April the 22nd, and to 40 and older by sometime mid-next week. When eligibility age does get down to 40 across the entire province, we're then going to prioritize all remaining police officers and firefighters, frontline healthcare workers, the remaining frontline healthcare workers, corrections officers, border crossing officers, public health inspectors, as well as our teachers, our educators, and others that are working in school education staff. They will all become eligible once we achieve that 40-year-old benchmark across the province. In the meantime, I would encourage everyone in those occupations who is now eligible based on their age, and everyone else in Saskatchewan who may be eligible based on their age, to get vaccinated as quickly as you're able. The only reason that we are having this discussion about who should get who should receive priority is that in this province, in this nation, we just simply don't have enough vaccines available. South of the border, that discussion is over. It ended yesterday when President Biden announced that every American is now eligible to get vaccinated. And that's because they do have access to enough vaccines. In fact, some states have more than enough. Over the past number of days, I've been speaking with the governor of North Dakota, Doug Burgum, and he had said that North Dakota does have a healthy vaccine supply. They're vaccinating people 18 and over, and that they may be able to set up a vaccination clinics just south of the border to vaccinate Saskatchewan truckers who are traveling northbound back into Canada. This is an extremely generous offer by the governor of North Dakota and by the people in the state of North Dakota, and one that is appreciated by myself and by this province. One that he was only able to make because their federal government has procured enough vaccines for Americans. We also discussed the relative success of the vaccination program in North Dakota. Their cases peaked at over 2,000 cases per day in a single day, as well as having more than 300 people in hospital. 46% of North Dakota residents today have now received their first dose. They are now down to about 140 cases a day, and they have 35 people in hospital. The vaccinations are working in North Dakota, and they will work in other areas of the world. This week, Saskatchewan will only receive just over 30,000 vaccines. That's about a 2 or 3 day supply at the pace that we are capable of moving. And as a result, we have unfortunately had to temporarily close most of our drive-through clinics that we're operating. We will continue to vaccinate Saskatchewan people just as quickly as we are able, but our efforts continue to be slowed down by the scarcity of vaccines as well as the often erratic supply of vaccines. So on the recommendation of Dr. Shahab, and like a number of other provinces we have seen move over the course of the last 48 hours, we are lowering the eligibility age for the AstraZeneca vaccine to 40. In the short term, this isn't going to make much of a difference because unlike some other areas of Canada, Saskatchewan has already used up the bulk of the supply of AstraZeneca doses that we received. And what's left is already allocated to a number of appointments across Saskatchewan. But moving forward, AstraZeneca will be made available to everyone age 40 years and older. Our dedicated health workers will continue to administer vaccines just as quickly as we receive them here. And what we all need to do, and we all do have a job to do in the days ahead, and what we need to do in the here and now, what we need to do right now, is to continue to do everything that we can to protect ourselves and to protect those that are around us. We need to keep following all of the public health orders that are in place, all of the guidelines that have been put out before us. And when it's your turn, we all need to consider rolling up your sleeve, sticking it to COVID, and receiving your vaccination. Dr. Shahab, are you on the line?
Yes, I am, Premier. Thank you. So, first of all, I'll begin by offering my condolences, as we always do, to the families and friends of the 8 Saskatchewan residents who have passed away due to COVID-19 over the past week. And again, while thankfully we are not seeing high rates of hospitalization in those who are older and in long-term care, we still know that COVID is a serious illness in all age groups, and that is why we all, as the Premier said, should step up and get vaccinated when our turn comes and abide by public health measures till that time. It's really, I think important to see the timeline for when additional essential workers can expect to be vaccinated. These essential workers have been working on the front lines throughout the pandemic, keeping our needs met and facing some risk. And again, I would encourage all persons, including essential workers, that as soon as they become eligible to step forward and receive any of the three vaccines that will be available in Saskatchewan. So as the Premier said, AstraZeneca, we will have limited amounts, but it can be used for anyone 40 and older now. Other vaccines, Pfizer can be used for 16 and older, Moderna 18 and older. And I would encourage everyone to get the vaccine that is available on that day at a clinic that they are at as early as possible. We have seen dramatic impact in Saskatchewan in older age groups. 3 weeks post-vaccination, there is a rapid decline in risk of COVID, hospitalization, and death. And we definitely want to see that continue to happen for all Saskatchewan residents currently 16 and older as vaccines become available. I will just make a couple of comments around the variants of concern. We obviously the bulk of new cases in Saskatchewan now, especially in Regina, southern Saskatchewan, and increasingly in Saskatoon, are of the B117 variety, which was first identified in the UK, which is more transmissible. And so we all have to work twice as hard to abide by public health measures to keep transmission of COVID and especially of variants of concern as low as possible. We did have a few weeks ago a cluster of B1351, the variant first identified in South Africa, in the north central part of the province, and that was quickly contained by case investigation by public health, and of course all cases and contacts doing the really important but hard job of staying isolated for the 14 days it requires for you to be cleared. So that in some cases for contacts can mean more than 14 days because it's 14 days from your last contact with the case. So again, it shows how important it is to follow all public health direction. We're all tired of COVID, but that demonstrates how in that particular instance, the B1351 was contained. And now in the southwest part of the province, we have a cluster of 5 variants of concern of the P1 variety that was first identified in Brazil. Of course, this has been seen throughout Canada and all over Western Canada, but this is the first time we have identified it in Saskatchewan. And then again, it speaks to people doing the right thing, getting tested as soon as they have symptoms after any interprovincial travel, any international travel. And of course, we have an excellent lab system that screens all COVID tests for variants of concern and is very rapidly able to do whole genome sequencing. Within a week of first being identified, the whole genome sequencing was available, and public health was obviously public health, works with cases and contacts as soon as a positive test is received, and there's that doesn't change once it's confirmed to a variant of concern, which in this case was P1. But it just speaks to how important it is for us to continue to follow all public health measures as well as public health recommendations for isolation if we are either a case of COVID or a contact, because while our vaccination program is picking up, we have to do all these other things, abide by public health measures and isolate if we are positive or a close contact, because both of these approaches will ensure that our case numbers start coming down, our hospitalizations and ICU admissions start coming down. Thank you.
Thank you, Premier Moe and Dr. Shahab. We'll take questions and we'll start on the line. Operator?
We have Phil Tank with the Star Phoenix. Yes, Mr. Premier and Dr. Shahab. I'd like to ask about the appearance, if we can learn any more about the Brazilian variants discovered. How concerned are you about those? Because we have seen, say, in Alberta and BC that they have caused quite a bit of issues there being more transmissible. And can you confirm whether any of those variants were connected to the party in Maple Creek
Dr.
reported last week?
So at this point, we don't have any linkage to other mass transmission events, and that wouldn't, not having that linkage is not surprising, I think. And we also know that once you have a variant of concern in a continent like in North America or a country like in Canada, it is to some extent inevitable that they will, increase anywhere in Canada. But we also have to remember that, like you said, compared to the original strain of COVID, we have already seen that B117 is more transmissible, anywhere from 60 to 100% more transmissible. So we have to work twice as hard. Thankfully, the B117 is covered off well with all three vaccines that are available in Saskatchewan. The P1 variant, we are learning more about possibly increased transmissibility. We are still learning about is it more severe or not, and we are still learning about how effective the vaccine is. So that is why we have to do everything we can to keep, first of all, we want to keep COVID cases as low as possible, irrespective of what strain they are. But also, we want to delay the introduction and wide dispersal of all variants. We've done fairly well with B117, that it is making its way up north from Regina to Saskatoon and points north. But for the time being, it's primarily in Regina and southern Saskatchewan. The South African variant is well contained. P1, this is the first time we've identified it, and public health is investigating all contacts. So there'll be broad testing of all contacts, isolation, which in some cases may extend to 24 days because your 14 days start from the last day of your contact with an infectious case, which in case of a household member can be up to 10 days, unless the case is able to isolate in a separate location. This is really hard for all of us to have to isolate as a case, but also as a contact. It disrupts our plans, but this just shows how important this is going to be in this particular situation. And till such time that our vaccination rates are up, as high as we can get, 70%, 80% for all persons 18 and older, and we see our numbers declining and our hospitalizations declining, as the Premier cited the example from North Dakota. It's going to be so important for us to continue to abide by public health measures at a community level, but also at an individual level, and also to seek testing and follow public health recommendations for isolating if you're identified as a case or a contact. And again, we've said keep your contacts as low as possible. If you are to test positive as a case, you should be able to immediately give all your close contacts to public health quickly, because the quicker that public health gets that information, the more quickly they can work at isolating potential COVID cases and contacts, which may be any of these three variants of concern. Or increasingly, I must say, there's other variants of interest that we are following from the US, from other parts of the world that we have identified in Saskatchewan as well as in Canada. They are not variants of concern yet because they haven't shown signals of being either more transmissible, more severe, or more vaccine resistant. But this is going to be something we'll have to keep watching closely, especially till such time that we have high vaccination rates and our COVID case numbers come to very low levels. Thank you.
Follow-up, Phil?
Yes, the numbers of people in receiving intensive care hit a new high of 51 today, and that's kind of been the trigger point across Canada for in other provinces for saying, we're going to increase health restrictions. Are there any plans to look at increasing health restrictions at this stage? I know you're extending them, but I think we've seen Ontario, BC, Alberta and even Manitoba yesterday take more drastic measures, and some of those provinces have higher per capita or lower per capita cases than we do, and lower new cases per capita than we do.
Dr. Shahab, maybe just a couple of words if you want to comment on that as well. Of course, more than more than welcome. With respect to the hospitalizations here in Saskatchewan, yeah, they're higher than I think anyone would like to see them. In particular, here in Regina, we do have provincial healthcare capacity, although with the concentration of variants of concern here in Regina, we do have a significant pressure, I think would be fair to say, on our ICU here in Regina, as well as the healthcare system here in Regina. As Dr. Shahab had said, those variants of concern, the UK variant hasn't been moving across the province throughout the north as maybe quickly as he had expected, which is a positive thing. But we do need to keep an eye on our healthcare capacity, most certainly, and we are keeping an eye on that. And ultimately, the path through this, and I used the North Dakota example, is for us to continue to encourage folks to, one, follow the public health measures that are in place, and I think by and large people are continuing to do that. And I would just ask once more for them to pay particular attention to the public health measures that are in place at this point in time. It's likely one of the most crucial. The next couple of weeks are probably some of the most crucial time that we have been in the COVID-19 pandemic, in particular here in our capital city and the surrounding area. And then the second piece is the second job that we all have to do is, when it is your turn, go out and receive the first vaccine that becomes available to you. They're all effective, they're all safe for your age category, and ultimately the way for lower hospitalization numbers is for us to continue to provide and accept those vaccines into the general population. Dr. Shahab, any more on that topic?
Yeah, so obviously this is something we continue to watch very closely, and we did extend measures that we had in place prior to Christmas. No household bubbles, worship sizes capped to 30, and all other measures throughout Saskatchewan are in effect, and of course tighter measures for Regina. Regina, like the Premier mentioned, our cases have plateaued. They are not continuing to go up, but they are still generating significant hospitalizations in younger cohorts, which again is very hard. I think while deaths unfortunately do happen and maybe less common, nevertheless, it is not a trivial thing to be hospitalized and to be in ICU at any age. So obviously that's a concern for Regina. We've seen the variants of concern increase in southern Saskatchewan. They don't have the same orders that Regina has, but we've seen how, in many cases, businesses, restaurants themselves have been promoting takeout and curbside pickup. Individuals have been reducing, the number of contacts when they're out and about grocery shopping. Again, we have to be really watchful for all workplaces, especially essential workplaces, really improving COVID protocols. All those measures are having an impact. Saskatoon, we are very concerned because the proportion of variants of concern in Saskatoon is now, at around about half of the variants of the cases in Saskatoon are variants of concern, around 40%. So again, so while Saskatoon has seen a relatively stable case number, or around 40 to 50 a day, and test positive is 5.6, they really need to stay the course. We don't want Saskatoon to escalate like Regina. And so far, with current measures, it seems to be working. But again, everyone needs to diligently follow all the guidelines. One or two super spreader events, like unfortunately happened in the Southwest, can tip the balance to rapid growth. And so obviously, we are at a critical point right now. On a positive note, vaccinations are accelerating 40 and older, and then people who are more likely to be exposed, essential workforce in many areas. But at the same time, we need to stay the course over the next 4 to 6 weeks at least to keep our numbers as low as possible as vaccines get into arms, and have the 2 to 3 weeks post-vaccination that it takes for you to get some protection at an individual level. And each person who is vaccinated protects themselves, protects their household, and protects the community. So I think both these measures are going to be critical.
Scott, would you have any comments on the provincial capacity or not on that?
Well, I think you touched on it, Premier. I just, to reiterate your comments around ICU capacities, we are on bypass in Regina, and those Regina cases in ICU represent 2/3 of all cases across the province. So it's important, as Dr. Shahab and you've already highlighted, how important it is for folks to double down on not just getting vaccinated, but also adhering to all public health orders and getting tested as quickly as possible so that we can follow up on cases and get in front of this virus. If other ICUs in the province start to experience what Regina does, we're going to be in real trouble. And we've talked about that a lot, but it's a real risk for the system, and it's important that people understand that risk.
We'll take another question on the line, operator.
We have Laura Sharpaletti with CBC.
Hi there. Thanks for your time. My question is back again about the P1 variant. We've heard from multiple doctors and people around Canada who say that this variant is a lot more dangerous than the other ones that we've been seeing. And I'm just wondering if there's a contingency plan for, increasing testing capacity and contact tracing capacity in case this was to get out of control.
Dr. Shahab, on the P1.
I think one thing that we can be very proud of is that for the first time ever, our testing rate per 100,000 is above the recommended levels throughout Saskatchewan. And I think that speaks to the fact that everyone in Saskatchewan, south, rural, urban, north, Saskatoon, far north, everyone is getting tested in record numbers. Our daily test rates are well around the 3,000 plus per day. And that is going to be really critical. And the second is, of course, we have to recognize that at the first sign of symptoms, isolating, not going to work or school, getting tested, and that quickly informs who your contacts are, having the smallest number of contacts, having that list ready for public health. The more quickly we do these actions, it doesn't matter if it's an original strain, which variant it is, these basic fundamental actions are essential to keep our numbers low. And of course, till such time that we are vaccinated, our case numbers are low, maintaining that physical distance when we're out and about, wearing a mask in indoor public places are all critical actions. The weather is great. You can safely do a lot of things outdoors, maintain your physical distance, but having, being safe outdoors means that maintaining that physical distance, we've seen some transmission events where people were outdoors, but were maybe meeting over food or passing other items back and forth without maintaining that 2-meter distance. That can still really result in transmission even outdoors. But generally, we have seen outdoors is much better than indoors. And over the next, 6 to 8 weeks, spending time outdoors more and following all the other things I mentioned indoors is going to be really important.
Follow up, Laura?
Yes, thanks for that. So a colleague of mine is working on a story about Lakeview Fine Foods. Their staff is mostly under 40 and not eligible for vaccines, but their counterparts at like Safeway, et cetera, are because of the pharmacy there. Now, the owner is saying that it gives preference to bigger stores. Will you consider adding, again, I know we ask this every week, would you consider adding grocery store clerks and workers to the eligibility list, even if they're in smaller stores without a pharmacy?
There's just a few comments, Dr. Shahab, if you want to say something here as well. But we've always said that we're going to preserve the capacity of the nation-leading capacity of delivering vaccines that we have here in Saskatchewan. In fact, this week we're adding our pharmaceuticals capacity to our appointment-based system, as well as we're still going to be running as many drive-thrus as we can. And as we have vaccines for over the course of the next couple of weeks, given that we're only receiving about 31 or 32,000 vaccines here this week. There's a number of entities I know and workplaces that would request to be prioritized. What we're trying to do is to prioritize some of those that are at a higher risk of contracting COVID when we hit the 40-year age mark. Given the 40 and over is the age groups that have the most severe outcomes when they do contract COVID. But so what we're attempting to do is prioritize some of these work areas where people are obviously in contact with a number of people without compromising. We want to complement, not compromise, the capacity of the system, and why we had chosen those larger workplaces that may have a grocery store and a pharmacy operating is the pharmacies are receiving their vaccines this week. A number of pharmacies in a number of communities across the province, more coming next week, is it's fairly straightforward for them to turn around and vaccinate their staff as quickly as possible. That being said, we're still, and why we are continuing to prioritize the capacity of the system is we're going to move to 44 years of age across the province later this week, 40 by mid next week, and we're going to continue to deliver at that high capacity of doses per day, as many as we receive, so that we're able to continue down through those years, ultimately get to where everyone 18 and over is eligible for a vaccine, which is in essence prioritizes everyone in the province. And it's our hope to get there as quickly and as soon as possible, so that everyone in this particular setting and everyone else in every other setting in the province that is over 18 will have access to those vaccines. And then we won't be discussing who's prioritized, who isn't. We'll all have equal priority at that point in time. And we saw just this I guess late last week it was that President Biden had gotten to that point in the U.S. They obviously have access to a larger proportion of vaccines per person than we do here in Canada, as everyone in the U.S. now is over the age of, I believe it's 18, is eligible to receive a vaccine throughout the USA. We hope to get there in Saskatchewan as quickly as we're able, and that will, as I said, that will end the conversation around who's prioritized and who isn't.
We'll take our next question in the room. Murray?
I think follow up to Phil's question and for Dr. Shahab, I think mostly, if we're seeing 106 cases in Regina today and record ICUs across the province, how concerned or how much do you share the concern of the ICU doctors in last week that Regina's the problem, that the Regina ICU is at a near breaking point? And in that regard, what did you recommend specifically to deal with the Regina situation that does appear to be somewhat different than elsewhere, but certainly is something that would seem to require something more direct?
Yeah, so I think first of all, it is very concerning that just Regina on its own and maybe some communities in the south are generating high ICU and hospitalization numbers in Saskatchewan, primarily in Regina, but to a lower extent in other southern communities and in Saskatoon. And obviously, if what is happening in Regina was to replicate in Saskatoon, other communities, that would be put a tremendous pressure on the acute care resources. So right now, the specific measures in Regina are having some impact, but we also know that, and we've seen this in Europe and other parts of Canada, public health measures have a role, but it is also our individual actions. You can have strong public health measures, but it's, if our individual actions are not very thoughtful and deliberate in terms of minimizing a number of contacts, being very careful if we have to work outside the home. Our COVID protocols at work must be airtight, not just at a workstation, but also during break time. Employers need to support staff to be home if they are isolating or sick. You don't want someone coming to work because they have to if they're symptomatic. Ready access to testing, which we have. Support for isolating at home or at a third site if required. All those measures are going to be critical. And even if we go out and about grocery shopping, in Regina, of course, you can only order takeout, but everywhere else in Saskatchewan, relying more on curbside pickup and takeout, being very thoughtful when we go around grocery shopping, just one person from a household, if possible, spending as little time in a grocery store, wearing your best mask, maintaining that physical distance. All these measures are going to be critical. So, Regina is plateauing right now. It's not escalating, thankfully, but it's not coming down. So still a high level of concern. And we need to watch that very closely. And of course, southern communities also have trended up a bit. They have to be watched very closely. Saskatoon, again, I think is stable at around 40, 50 cases a day, with predominant variants of concern now. So obviously, it's a very critical situation. But on the other hand, Saskatchewan has been moving vaccine as quickly as it comes into arms. I think for a large province, it's a credit to the Saskatchewan Health Authority staff and the logistics people that vaccine is into arms throughout Saskatchewan as soon as it comes. I think pivoting for rapid deployment at a younger age in Regina of all three vaccines, including AstraZeneca, has actually saved lives over the last 4 weeks. So, that ability to be nimble and pivot to do drive-throughs as vaccine becomes available has been critical in moderating the surge in Regina, in addition to public health measures and everything we as individuals do wherever possible, working from home as much as possible is critical. And modeling that, if you don't have to be physically at a work site because your work doesn't require to you, I think you should be at home. And I think that's a critical thing for in all workplaces for us to model so that others don't feel obliged to come to work if they can work from home. But I think all these things are going to be critical over the next 6 to 8 weeks till such time that we have the bulk of our population 18 and older vaccinated.
A follow-up, Dr. Shahab. Are you then recommending greater enforcement for Regina or more restrictions? Have you recommended that to the Premier? Because I'm not seeing it in Regina stores. I'm not seeing it in other locations where people are any less restrictive about moving about than they were before. As long as stores are open, they go and shop in stores. And obviously, most stores don't like enforcing those kind of rules. So are you willing to recommend either stricter enforcement or stricter rules in order to curb what you're seeing right now so it doesn't spread in the next 6 to 8 weeks, as you say? And have you recommended that, particularly given what the concerns raised last week by the ICU doctors?
The bulk of our transmission is in workplaces, and many of those workplaces are essential workplaces. So they are not specially covered by the order. And that is why even though a lot of public places, museums and other public places, casinos are closed, restaurants and bars are only doing curbside pickup, the transmission really, the bulk of the transmission is happening in workplaces, many of which are essential workplaces. And it is hard because many of those workplaces have done really well during the winter, during a fall wave, winter wave. But right now, because of B117, they really have to improve their protocols, and many have. But I think that is going to be a key component, that in addition to the orders in place, minimizing transmission in indoor workplaces where people have to be at work, and really looking at each workplace and seeing which employee has to be physically present and who can work safely from home, because each little bit counts. Even if you haven't had an outbreak in your workplace for the last 14 months, going that extra distance now counts, because multiple small outbreaks, 3 cases here, 2 cases here, there, are what's adding up to the numbers. And thankfully, I must say, we have not seen super spreader events in Regina, or for the most part, in most places in Saskatchewan and in Saskatoon. That is also critical. We can't have any gatherings inside households, outdoor gatherings up to 10, and with no food or sharing of items. Worship sizes capped at 30. So the rules are there, but we're also paying special attention to that, because that is also going to be critical. And I think, while enforcement is important, but we all know the drill. And, I still feel that while we may sometimes feel that, a store is more crowded, but then the answer to that is go when it's less crowded. When you go, maintain your physical distancing. We need to help each other out here as much as we can to reduce crowding or the curbside pickup. A lot of it is having an impact, but we need to stay the course for the next 4 to 6 weeks.
Can I just get a response from you as well, Mr. Premier, in terms of either stricter enforcement or stricter rules for Regina?
Well, I think as Dr. Shahab had indicated earlier, the cases, and it's early days where we peaked last Thursday, and maybe they have been down since last Thursday, down about 13% on our 7-day average. But that in no means, I think, should we consider that a trend. But it is an indication that the measures that we have in Regina in place, which are much stricter than many other areas of the province, would hopefully seem to be working to some degree. That alongside the fact that we have prioritized Regina over the course of the last, month or so now, with any additional vaccines that we did receive provincially. I think of the first 15,000 AstraZeneca vaccines we ran through a drive-through clinic here in Regina, and the very successful drive-through clinic that ran here over the course of the last number of days as well. And so we do continue to increase higher proportions of people here in the province. I have said many times we're about 33% of all of those that are eligible over the age of 18 to ever receive a vaccine have received one here in Saskatchewan. When you get into the higher age groups, for example, 60 and over, we're at 75% vaccinated, which is a very strong number. 50 and over, 63%, and 40 and over, which is relevant to our conversation here today, both in the way of AstraZeneca now being available for those folks 40 and older, as well as when we hit 40, we're going to shift to a number of frontline, prioritizing a number of frontline workers alongside our age-based system. But 40 and over, we now have 51% of Saskatchewan residents vaccinated. So, as we receive them, and we have a little bit of a tougher week or 10 days ahead of us on the vaccines that are being delivered, but we most certainly are going to make those available to Saskatchewan people as quickly as possible. And like I said, by mid next week, we should be getting down to that 40 and over age group, which will then open up the opportunity for either at the pharmacy or through the SHA system for our teachers and in-school staff, our correctional guards, any remaining police and firefighters that we might have, public health inspectors, our border service agents to make an appointment, and to get vaccinated. And at the same time, we're going to continue trying to creep down as quickly as we can through the ages and get to 18 and over, which ultimately prioritizes everyone.
We'll take another question in the room. Stephanie?
Yes, just a little bit more on that point. With the delay that we're seeing with the vaccine shipments, has your timeline changed at all? I think it was originally mid-June was your goal for the first dose for all adults in the province. So has that changed because of the shipments?
Well, I guess it always depends on uptake. And we're hoping for, at least a 70% uptake across the population. We've seen what's happened in North Dakota in a jurisdiction where they had much higher numbers. If you go a few months back with they're at 45 or 46% uptake, one dose in their state right now, a state of about 765,000 people, where we've seen the hospitalizations, most importantly, really fall off. They still have some cases each and every day, but their hospitalizations are down to about 35 from a high of over 300. And so we, most certainly are hoping that we'll get a higher uptake than 45% and shooting ultimately for 70%. As far as the time frames go, we'll be down to 40 by mid next week. We feel that although we do have a difficult 10 days ahead of us with the vaccine supplies that we're receiving, about 32,000 of Pfizer each week, our Moderna shipment was cut drastically, as we all know, which has been problematic for a number of rural areas in the province. We've had to reschedule, I believe, roughly about 9,000 appointments again, which is problematic in the vaccine delivery plan that we have. We'll receive another shipment of 30,000 Pfizer before the end of the month. And trying to incorporate our pharmaceutical capacity now. But as we know, it looks like in the early days of May that we are going to increase. In fact, I think we'll see largely increased Pfizer deliveries. We're hoping for a Moderna schedule that will include increases as well. And we'd like to see some more AstraZeneca arrive in the province as well. But for certain, I think the Prime Minister had announced it the other day, that our Pfizer procurements are going to increase starting in what we hope is the first week of May, and I believe it is the first week of May. And that's going to really allow us to ramp up that pharmaceutical capacity we have, ensure our SHA appointment system is in place, and maybe even get us to a point where we can reactivate some of the drive-thrus for these priority groups, and then also to continue working through the age groups down into the middle of May, which is the target when we had hoped to make vaccines accessible to all of those 18 and over. That's still our hope and our target, is that we'll be able to achieve that by sometime in or about the middle of May. That is a very ambitious target, and it's one that we really hope that Saskatchewan people will, look forward to and taking the opportunity to make their appointment and ultimately get their vaccine when at the first opportunity that they're eligible.
Follow up?
Yes, we're still seeing and hearing from people almost every day who have, hesitations to getting vaccinated, specifically AstraZeneca. I'm just wondering, maybe a question for Dr. Shahab, have we seen any negative reactions in the province to I guess, any of the vaccines?
Dr. Shahab, do you want to make a few comments there? And then I probably have just a short comment as well.
Yeah, so I think, many of us, myself, many of my colleagues, we went when we were eligible and we got the vaccine that was offered to us. I was offered AstraZeneca, I got AstraZeneca. If I was eligible today and I went to a clinic and was offered any of the vaccines approved for use in Canada, I would take whichever vaccine is available. That is critical. This is not the time to hesitate or to vaccine shop. A vaccine only works once it's in your arm and has that 2 or 3 weeks to work. So sitting and waiting for a vaccine of your choice doesn't help you, it doesn't help your household or your community. And I think while we do hear of situations where individuals may be hesitant and may want to wait for another vaccine if and when that's available, we've also seen a lot of interest in people saying, AstraZeneca is licensed in Canada, 18 and older, why can't we have it? Why is the limit 55? And that's why, with consultation with NACI, we are safely now allowing AstraZeneca 40 and older can get the vaccine. In other parts of the world, in the UK, it's available for 30 and older. The bulk of the vaccination in the UK is AstraZeneca and then followed by Pfizer, half and half, most likely. So, all over the world, all licensed vaccines are being used to their fullest extent and should be used. And in Saskatchewan, those are, for the most part, Pfizer, to a lesser extent Moderna, but with some challenges with supplier recently. And AstraZeneca, we are sitting on very small amounts of AstraZeneca right now because people have stepped forward and had AstraZeneca, and all vaccines, including AstraZeneca, have saved lives. So I think none of us should be hesitant. We should trust that Health Canada approves vaccines that are safe and effective. We should take the first vaccine that's available to us. And the quicker we do that, the quicker, we will see our case numbers come down and we can exit the worst parts of the pandemic, hopefully by, mid to late June.
I would just add to that, we don't have enough vaccines in Saskatchewan or Canada for any degree of vaccine shopping. All of the vaccines that are offered are safe, and they do prevent the most serious health outcomes, and they do prevent death. All four that are qualified or approved in Canada, including AstraZeneca, and the 3 ultimately that we have received here. Maybe just a couple of comments on the variability in the conversation around AstraZeneca, and it hasn't been helpful, and I would just precurse, and I will end those comments with the same statement that all of the vaccines that are offered are safe for you, safe for your age group. But what we've seen is Health Canada that has repeatedly said that AstraZeneca is safe for those over 18 here in Canada. We've seen NACI, the NACI group, really have some challenges with the recommendations in particular that they have around AstraZeneca and have changed those from time to time, and now really are not commenting on the Health Canada recommendation of it is safe for those folks 18 and over. And with all due respect to my friend Dr. Shahab, I think if you peek behind the curtain at a NACI meeting, you would see a conversation of dueling doctors with their various opinions on precisely how this vaccine could, should, and would be administered. But we do see the Health Canada, which doesn't help the conversation around assuring Canadians that it is a safe vaccine, has been used widely and saved many, many lives, probably as many as any vaccine around the world when you look at places like the UK and many others. We have a federal health minister that has come forward and said it's not her job to recommend whether or not or what the age group should be for the AstraZeneca vaccine, but To his credit, and you won't hear this from me often, but to his credit, the Prime Minister has probably provided as much clarity around the AstraZeneca vaccine and whether or not it's a safe vaccine to take by announcing today that he's going to receive the AstraZeneca. We in Saskatchewan have a very credible source in Dr. Shahab that has received his AstraZeneca vaccine, but I would credit the Prime Minister for stepping forward as it is the first vaccine that he is eligible to receive, and publicly stating that he will be taking that vaccine. And if it's good enough for the Prime Minister, I think Canadians should take a note from that. The best clarity, next to the Prime Minister today, of course, that we have had in Saskatchewan around being clear on the safety of all of our vaccines, in particular AstraZeneca, has been from Dr. Shahab and his team, who have come out today, in very earnest but very forceful fashion, and say this is a safe vaccine for Saskatchewan people that are age 40 and over, and that's where we're going to provide it. It doesn't impact to a large degree the vaccines that we currently have, as they are allocated for our appointment system across the province and are being delivered as we speak. But if we are to receive additional doses of vaccine and we're able to fit those in, we most certainly would.
We'll take our next question on the line, operator.
We have Lara Falmanoff with 650 CKOM.
Thank you so much for taking my questions. Dr. Shahab and Premier Moe, we've heard over and over again throughout the last year the talk about personal responsibility, and that people need to follow guidelines. They need to be personally responsible for their actions and so forth. With case rates remaining as high as they are you suggesting, implying that there are a lot of people out there who aren't being responsible?
Dr. Shahab, you want me?
I would say no. Actually, the bulk of the people are being extremely responsible. But the challenges we have are the following: that with more transmissible variants of concern, even settings that were, due to excellent COVID protocols, low risk for transmission, namely many essential workplaces, are not now having transmission. So that's why, and I've been saying this now for about 6 to 8 weeks, all workplaces need to and have revised their COVID protocols, making sure that there's physical distancing at work, there's mask use in indoor places and workplaces where you are in an indoor place with others who are not from your household, employers providing where that 2-meter distance can't be maintained, employers but providing the best PPE available to non-healthcare workers, which includes, in many cases, for example, in personal care services, a medical mask and a face shield. All those things are and remain critical and are doubly critical now with variants of concern. And, it's no one's fault that if, you are an essential worker, you're working hard in a grocery store, in personal care services, in a gas station. It's no one's fault that transmission happens, but we all need to do everything we can to, as employers and employees who have to work outside the home, to minimize transmission, and special caution around break times, avoiding carpooling as much as possible, working within a cohort when you can't maintain that 2-meter distance. All those things are going to be critical for those who can work from home for as long as possible till such time that we're all fully vaccinated. That is critical. And again, where you can, so in Regina, you can only order takeout, but the rest of the province, even if you can go to a restaurant or into a retail location, ordering more curbside pickup, takeout, going when it's less crowded, maintaining that physical distance, going in a very deliberative way. We've been doing that throughout the pandemic. In March 2020, in the fall, pre-Christmas shopping, we did that in a way that our case numbers came down. And that we need to revisit all of those things. And at the end of the day, it is our individual behaviors. A lot of these orders kind of facilitate some of that where required. And of course, enforcement is there to use when there's blatant disregard. But at the end of the day, it has been and will always be about our individual actions. And the vast majority of residents are actually taking those actions. And although our numbers are very concerning, we can see what's happening in Western Europe and in other parts of Canada. And again, this is the time really to pull together and really minimize any risk of transmission as much as we can. But if transmission does happen again, staying home if you're unwell, getting tested, having your list of contacts ready. That's the second layer, that the offensive strategy. Prevention is number one. Quickly isolating as a case or contact is number two. And of course, we don't want to see anyone go to hospital. But unfortunately, while on a positive note, we're not seeing high numbers of hospitalization deaths in people 70 and older. We are concerned that because the variants are more transmissible and maybe more severe, we are seeing high hospitalizations in the people who are now becoming eligible for vaccinations, 40 and older, and then ultimately 30 and older. And I think that is going to be critical. And secondly, very quickly, apart from workplaces, the second transmission side is unfortunately the household, because we've seen that in the far north, northwest, that if you have crowding in the household, it's very difficult to prevent transmission. That's where assisted isolation sites have been so critical. We now have capacity to assist in isolating if you can't safely isolate at home. In any situation where public health and social services will assist, and I think that where that is required is also going to be a critical tool for the next few weeks to minimize secondary transmission within the household. But again, we all need to comply with isolating if as a case or as a contact is hard to isolate for 14 days, but that is going to be especially critical as well. So a lot of it relates to public health orders and enforcement, but the bulk of this has been, is, and will always be our individual actions. And for the most part, there's a high level of compliance. It is not our fault that we are facing variants of concern, but we are facing them and we need to deal with them.
I would just agree with everything Dr. Shahab said.
Follow up, Laura?
Please. We're hearing a lot more appointments that have been canceled aren't being clearly or effectively communicated with people who book those appointments, especially in some rural areas. Do you think that the appointment booking system and the notification for cancellations is going as smoothly as it can be, or are there some bumps in that?
There will be some challenges. Scott Livingston will speak specifically to those. But I would say due to the Moderna shipment that has been delayed at least once, at least twice, and possibly even a third time, if I'm not certain on the third delay. We have had a number of appointments that we have had to rebook. The Moderna shipments, as we know, the Moderna vaccine was being utilized in a number of more rural locations here in the province. So, this is just another example of an erratic delivery schedule and a reduced delivery schedule that has, I know, caused tremendous challenges throughout the SHA, throughout the folks that are operating and planning our vaccine rollout here in the province, and it's ultimately at the end of the day the very crux of the challenge that we have here in Canada is a lack of access to the sustainable supply of vaccines and enough vaccines in short enough order. But specific, Scott, if you wanted to make a few comments to some of the different ways that we book and maybe some of the challenges that presents in rebooking of some of these appointments, and maybe how many due to the Moderna changes in supply, reductions in supply that we've received.
Thanks, Premier. And you certainly covered most of it. It is certainly not a fault of the system itself, the booking system or the phone lines. It's really the erratic nature of the delivery, particularly around Moderna and in those communities that you've pointed out that has been a challenge, where we're not just canceling single appointments, in some cases 2 appointments because of the delay with short notice for Moderna. We are working hard to try to correct and streamline that process. And part of what we'll be doing going forward is not booking out as far in advance so that we can be more reactive to available supply for those individuals across the province. Certainly, we don't want to cancel any appointments, but as the Premier has already pointed out, the erratic nature of the supply, particularly around Moderna, has been the single biggest factor. And we are working hard with the communities and our clinics across the province to mitigate any impacts at all on patients, but it's unfortunate to the numbers. Recently, Premier already talked about the 9,000 Moderna appointments that we booked, but I think it's well over 21,000 appointments that we've had to rebook strictly because of the erratic supply of Moderna, which has been problematic. And as Premier had already pointed out, we still don't know what that supply will look like for May, but we're hoping that not only are we going to see some big numbers of Moderna, but it'll actually arrive when they tell us it's going to arrive.
Credit goes to all the folks that are working hard on trying to rebook these appointments. The booking system has worked remarkably well, and a credit to all of those people that worked on that as well. And you know, we do ask Saskatchewan people that need to rebook their appointments. Some patients, it is it's been thrust on us by the erratic supply of Moderna deliveries. We're doing our very best to provide you with the vaccine as quickly as we're able.
We have time for one final question, operator.
We have Anna McMillan with Global.
Hi there. Premier Moe, you were on the radio, I think, last week discussing a potential return to some degree of normal. Do you think it's at all premature to be talking about getting back to normal? What was the conversation had today about variants and current case counts?
I would say it's premature to be announcing us moving forward to getting back to normal at this point in time. We have one job to do. Well, we have a few jobs to do in the here and now as all of us, as individual residents of the province. And the first job we have to do, I would put forward, is to follow the public health measures that are in place for the foreseeable future. It is of crucial importance that we all prioritize our actions each and every day. The second thing I would encourage Saskatchewan people to do is, as soon as you're eligible by age, or whether you're one of these priority groups, to make an appointment and receive your vaccine as quickly as you are able. But when you look at other jurisdictions around the world and the vaccination rates that they have achieved, and what that has done for their case rates, what that has done for their hospitalization rates, and you look at where Saskatchewan is, with 33% of our eligible people over the age of 18 that have received a vaccine. We have now 51% of people over the age of 40, and as I say, 84% of our hospitalizations have come from people over the age of 40, and 96% of our fatalities have come from people over the age of 40. We're going to be making that vaccine available to everyone over the age of 40 by next week. I would say that in the weeks ahead, there will be an opportunity for Saskatchewan to really look at, given our hospitalizations would ultimately be decreasing at that point in time, our case rates decreasing as our vaccination rates increase, understanding there's a lag between vaccination date and when they ultimately are effective, that we should be prepared for what that looks like. And so today I would say is premature for us to be putting forward dates and times as to when this may occur. But in the weeks ahead, I think it is a conversation that, given continued delivery of vaccines and those vaccines doing what we've seen them do in other jurisdictions, that this is a conversation that Saskatchewan people are ultimately looking for.
Follow up, Anna?
Yes, I'm just hoping, with that in mind, can you just provide a bit more detail on how vaccination is going to work for frontline workers going forward? Once everyone over 40 is vaccinated, is it essentially just going to open up and be a first come, first serve for those workers? Well,
we'll have, as we get into the first days of May, we are hopeful that our delivery schedule is going to increase, in particular with our Pfizer vaccine accessibility. Scott Livingston had said we're also, very hopeful. We don't know yet what Moderna will look like, but that also would be increased sometime in early May. And then we would be hopeful for a period of time that we would be able to continue on with all of the methods of vaccine delivery that we are able to. The SHA appointment system, which has been very effective and really the core of our vaccine delivery system throughout our time thus far. Our drive-thrus, as well as we are making vaccines now available to pharmacies who have a very large capacity. I think pharmacies actually delivered 70% of the flu vaccines last year. So we will have that capacity to deliver the vaccines ultimately that are delivered to us. So when we do hit that 40 age category, we're going to split our focus to continue to drive down that age to 40, from 40 to 38 to 36 to 34, as low as we can. But we're at the same time, we're also going to prioritize a number of folks, essential workers essentially in many cases, and so that they will be able to receive their vaccine. And we're just working out what the details of that will look like, whether it's a letter of employment from their employer that they could present to ensure that they would be able to make their appointment either at their pharmacy through the SHA system, or if we do have a drive-through operating in the area, that letter of employment would be suffice as well. A little bit to work out on the actual logistics of it, but I'm sure working with each of these organizations that we'll be able to come to some agreement of identifying them quite quickly.
That concludes today's update. Thank you for joining us.